Hello, yeah, I'll be streaming again. I thought I'd do one for a different time zone today. Feeling a little bit better than I was yesterday. Got a bit of still got a bit of a cough and all that. Feel quite achy, but I don't feel sort of as hot and all that as yesterday. So hopefully a notification goes out for this. Obviously, as I said, doing one for a different time zone. Because, not everybody gets to see them when they're in the evening. If I'm up to it, I might do one in the evening again today, but I hope you stay safe then, Russians fine, but hello to everybody. It's not even 1 p.m. where I am at the moment. A bit better today, cool sax player. Don't feel as hot and everything today as I did the other day, but I still feel quite lethargic and achy. But when I woke up today, it literally felt like I've been punched during my sleep in quite a few different places, where you just feel like, that sort of thing. But anyway, we'll have a stream for the people, in a different time zone. Yeah, all of Italy is locked down. It's pretty dire in the north of the country, although it's going to get quite bad everywhere, I should imagine. Yeah, the Israeli M15 is just standard 40mm. Cheers, Samuel. Like I said, I'm feeling a bit better than I did yesterday. Obviously, I don't feel right, but completely unadvised at the moment, Sukabliat, because at the moment, if you're infectious, they don't want you going anywhere near a hospital or doctors, even if it's flu, colds, whatever. So I'll get up the tracker and we'll see what the numbers look like today for the countries that have done updates. China, 26 new cases and 17 deaths. Iran, 881 new cases and 54 deaths. Iran's total cases is just over 8,000 now, but quite a few places estimate they're actually between 500,000 and 2 million in reality. South Korea, 35 new cases and 1 death. Spain, 281 cases and 5 deaths. Germany, 57 cases. America, 25 cases and 1 death. Japan, 13 cases and 1 death. Switzerland, 123 new cases and 1 death. Belgium, 28 cases. Sweden, 4 cases. Norway, 13 cases. Austria, 26 cases. Denmark, 66. Bahrain, +1. Australia, +10. Greece, 5. UAE, 15. Iceland, 4. Kuwait, 4. Israel, 8. India, 9. Thailand, 3. Lebanon hasn't had any new cases, but 1 person has died from it. Portugal, 2. Czech Republic, 2. Finland, 7. Philippines, +9. Brazil, +5. Indonesia, 8. Pakistan, 2. Poland, 1. Estonia, 2. Hungary, 3. Anyway, the list goes on and on with the low numbers, but the UK, I think, does an update normally about 2 p.m. So the UK figures are probably going to be up quite a bit. North Korea's apparently got no cases, but we know that's a lie. Yeah, most European countries, Steiner update in the UK time at least around 2 p.m. to, I think it's about 8 p.m. sort of time. It's that sort of few hour time slot. I think it's a bit higher than that. Let's have a look. Current cases, 116,000 cases. And there's active cases, 47,000, as in people who haven't recovered or haven't died yet. A lot of places have been selling out the toilet paper, macaroni. All right, Pete, the dreaded thing of waiting in for a parcel. I think 60 to 80%, Alex, is estimated to get infected eventually. Yeah, I heard that, Joseph. Apparently, it's if you go to Israel and you've got nowhere to stay, you're sent back immediately. If you have relatives or somewhere where you can be trusted to stay, you have to go into 2 weeks of quarantine. But to be honest, that's at least a sensible measure to try and slow down the rate of infections. The UK is doing nothing like that. Well, as of today, they actually did say if you come from anywhere on the flight in Italy, you need to self-quarantine. But Yeah, I'm feeling better today, Aussie and Peach, than I was yesterday. I've not been coughing as much today. Temperature feels better, but I'm still really achy and kind of lethargic. Again, like really struggled to get up today, where you just feel like almost delirious. But yeah, here's the thing: if you're not testing, it doesn't mean you don't have cases. It just means you don't know you don't have cases. Again, it's like if you've got a reactor on fire and you don't have a Geiger counter or dosimeter, it doesn't mean there's no radiation. It's that kind of thing. Yeah, that's a good point, Macaroni. If nobody's buying baby wipes, you can use those, I guess, as toilet paper. They'd be actually quite efficient for that. Yeah, it's not great having to wear a mask if you're doing stuff, but that's going to be the reality for a lot of people. Yeah, I've had cranberry juice before. It's quite nice. Benji said, would a Polish FP203 work? I know an FP5 filter would be better, but they are shipping for so much. Yeah, FP203 filters are fine. Are they the big red ones? They're fine. To be honest, if people are going out and about wearing masks, I think that's a sensible thing. I had to go to the pharmacy earlier today, Vic, so I just made sure I kept really good distances between me and other people. But I noticed they were spraying everything down in there today when I went in with disinfectant, so they're taking it quite seriously. And one of my prescriptions they can't get in now just because the supply chain's not working, so that's great. That's why I always make sure I get my prescriptions in early. But that's something I'm used to at the best of times, and now that doesn't surprise me at all. Don't forget to like the stream if you're on at the moment, because there's 105 people and no likes, so it'd be good if we can get some likes on it. But most countries, Safi, do like an update roughly at one time of day every day. The UK is normally 2 to 3 p.m. sort of time. Most countries never seem to do it at a very reliable time. Is that UK still at 3:19? It's because the UK does it like 2 p.m. each day. A couple of countries seem to update throughout the day, but the UK, we're at 3:21, and they always seem to be around 2 p.m. to like 2:30 p.m. Let me look up 3M head tops. I'm not sure which one you mean by that. Oh, is that like a powered air hood or one without the powered air hood, just that protects your face? That certainly would give you some protection. Problem is, I don't know if there's filtration systems in those. If there's no filter system, it's not going to protect you from inhaling anything. Afternoon, Rich. How many cases does Greece have? Because that would be the easy way of working it out. Greece is 89 cases plus 5. I imagine you'll probably seeing early stages of community transmission in Greece. Yeah, Polish FP5 filters will be fine. If it's a powered air hood and it's running through a filter, it'd be absolutely fine for that then. A little bit crisp, but definitely better than yesterday. I think getting another good night's sleep helped, but I'm definitely not feeling myself. But at the moment, it just feels like flu in all honesty. So I think that's probably what it is. But as said, luckily this weekend I've got work booked off as holiday anyway, so that was very convenient timing in all honesty. Yeah, a lot of people said Daniel they either got one late or didn't get one. But if you look at how many people are on it, I guess notifications haven't gone out, because normally these sort of streams at the moment are getting like 500 to 800 viewers on. Although it could just be because I'm doing on a different time zone. A lot of the people who normally watch in the evening aren't on. For also the people saying, did I have tonsillitis? I've checked. No, there's no weird like white spots at the back of my throat. My glands are swollen, but you get swollen glands anytime you get an infection. So yeah, a bit better today anyway. But, obviously I still don't feel normal. I still feel very lethargic and achy, but I don't feel all that bad. I've got the blood oxygen monitor thing coming today. My temperature's still fine. The thing is, yesterday my temperature was still like 36 to 37 Celsius. But I felt hot today. I don't even feel hot. bit of neck pain as well. So I've had neck pain, sort of achy, shoulders, legs, arms. It's just that general kind of, flu kind of lethargicness, I think. So it could just very well be I've got the flu or got like a really, really bad cold at the moment. But again, I've not got a runny nose or anything. So normally when you get a cold, you're always sneezing and got a runny nose. I've not been sneezing or a runny nose at all. I've been coughing badly 2 days ago. Then yesterday I was coughing badly in the morning, and the cough's been subsiding a bit since then. But about 37 degrees Celsius. Person with, I guess, a Vietnamese name or something like that, is it? I probably won't be able to pronounce your name, but yeah, so my temperature's absolutely fine. It's right where it should be. But yesterday, I said I was feeling like really hot and sweaty, even though my temperature wasn't. I think people were saying if I was taking paracetamol yesterday, that could have been lowering my temperature, so that could have been that. Oh, YouTube demonetizes every single thing to do with COVID-19, which is why you'll see a lot of channels aren't using the words COVID-19 or like coronavirus or anything like that in the names, because they're trying to, find ways where people know what they're on about without YouTube putting the auto like bot ban on it. I've seen stuff, Khalil, about, like going to some mosque or something where the government said it has antiviral properties, where, no, don't do that, use science, please, with this sort of stuff. When you say breeding, I guess you mean breathing, McCann, but a JSP 48 with the P3 filters will last literally months to years. Particle filters only eventually clog up. Well, as I've been saying, if you don't know, in the UK, what they advise you to do at the moment is phone 111. If you phone 111, what they'll tell you to do is just sit at home. That's literally the amazing level of the UK system. Unless you have been recently to Italy or Iran or China, I imagine they won't even run a test on you. No, I've not had shortness of breath, thankfully. Let me read Rajiv's quote. He said, of more than 6,500 nurses across 48 states, just 44 said their employees had given them information on novel coronavirus and how to recognise and respond to possible cases. That's bad, isn't it? In the UK, apparently, a lot of hospitals haven't been giving out proper personal protective equipment, PPE, to like nurses and doctors, which gives you an idea how bad it could be spreading to doctors and nurses, have to respond to patients if they're not even being given, like masks or like aprons or anything like that. Joe says, what do you think about the Climax respirator 755, 756? Let me look it up. I've used the Climax 731 before, and that was very good. Let me look that one up. Oh, is that like a Climax one, but a half face mask with 2 filters? That'd be perfectly adequate. If it's half face mask, wear it with goggles. But also, when I went past the petrol station today, because that's near the pharmacy where I am, the petrol station again, loads and loads, like people queuing up for petrol. I don't know if that might just be as well because it's really cheap at the moment because of the oil crashing. Thank you, Trumpet's call. Yeah, that a few people are saying that's why it's been so good in South Korea relatively, and Taiwan and Hong Kong, because when the governments tell people to wear masks, it slows down the rate of infection, even if it is just surgical masks, because it's harder to cough on other people, and it does give you a tiny bit of air protection. So if a government enforces sort of stricter hygiene rules, it will at least slow down the rate of infection. Although there was the very worrying thing, I don't know if you saw Dr. John Campbell's video from today, but he was saying they had a case where it spread on a bus where the person was like 4.5 meters away from the other person on the bus and still got it. And then somebody else got it later from going on the same bus and didn't even touch the same surfaces. So it gives you an idea of just how efficiently airborne it is in, buses and trains, I think, and things like that. Yeah, I came down with something yesterday or Sunday night. but it's a bit better today than it was yesterday, but I still feel very achy and lethargic. Yeah, that's why I'm streaming lift at this time of day, so Australians can get in more easily. Yeah, 4.5 meters. How far is that, do we reckon? Probably like the distance from most houses, I guess, from one side of the room to the other. Apparently, Dr. John was saying in his video that's like twice the distance doctors normally observe for, contagious diseases. Now, that was in China, Rajiv, but it gives you some idea, doesn't it, of, like how it's more contagious than a lot of people have initially thought. I don't know, Caben, if I've got it or not, but I certainly feel like I've got a flu kind of thing at the moment. And somebody else I was at work with Sunday has come down with like the exact same symptoms in the exact same time frame as me. So, yeah, that was another good point, Daniel, wasn't it? That it's literally if somebody's been on a bus and been coughing or whatever, everybody getting on that bus could get it for like the next half hour or whatever, which loads of governments have been saying that lift. Masks don't help you, but we want them. Yeah, exactly. It could just be a cold or whatever else. I don't know. What are they saying, MJ? What sort of things are they saying at the moment? Yeah, exactly, Arnold. You really don't want to be on public transport of any sort at the moment, do you? Right, let me look up what that is, because a lot of people have been just saying weird fake things on here recently, or like trying to shill for certain companies, so I'm going to have to look up what this is. But I don't know if it would be a real thing or not. Oh, is that breathing exercises? Well, that would certainly help with a lot of things. There's lots of things like that help, even if it's psychological, which is always good for yeah, that's more flu symptoms, isn't it, Gillian? Not cold symptoms, but what I'm saying is it could just be regular flu, because we're still in the flu season at the moment anyway. Yeah, that's good advice, getting proper masks for people, especially if they're in a more vulnerable group, like the elderly, people with underlying conditions. Only as of today. Prior to this, they just said only quarantine if you feel ill. So the UK has really dropped the ball on this. If you think it's bad in Italy, wait till you see what it's like in the UK in 2 weeks' time. Because what's going to happen, basically, is because they've been so lax on not cancelling big public events, telling people masks weren't necessary and all this sort of stuff, the UK is going to get hit really hard by it, and Italy has a better healthcare system than the UK has. So, all right, Laser. That's good that you can stay on for this one, but thank you very much. But yeah, it's this is why I was doing one today at this sort of time, because I ended up being free. Well, I've had a few of those, Gillian, but a lot of those are also regular flu symptoms, aren't they? So again, it's hard to say. I don't want to be, like I said, when I did the stream yesterday, I had people going, "Oh, how dare you say you might have it?" I was saying, well, I just fit the criteria of a lot of the symptoms, don't I? But as I said, I'm just distancing myself. Everybody in the house is being quite careful at the moment, not to get too close to each other. I'm avoiding people as much as possible at the moment. Yeah, if there's doctors mocking people for wearing masks over mold, they're being stupid. I know a lot of doctors are like, we don't know how effective lots of masks are, which is fair enough, but just to say people wearing protective equipment because they don't want to spread it as well. Again, it's like one of my Hong Kong viewers was saying to me, one of the reasons that it's actually been working well in Hong Kong is just because they've been enforcing lots of masks and standing certain distances away from people, which is actually a really good thing to do. Yeah, Tom, don't cancel a thing where 250,000 people might attend, because, like, have you heard the awful thing the government was saying here, that if they cancelled football matches, they said more people would get infected than if they didn't cancel it, even though we know it spreads several meters in the air and is airborne. Yeah, they were going, oh no, if more people stayed at home, they'd infect more people than if they went to the thing. Cheers, Cram. Oh, they were saying on LBC today that in some NHS hospitals where they have the, sanitizer hand pumps, you've got dickheads going in with like massive water bottles just to take as much sanitizer as possible to either resell or hoard it. Cheers, Maxi boy. As I said, feeling a bit better today than yesterday, but still don't feel great. But yeah, like obviously having a good rest last night certainly made me feel better than yesterday. Just to make it very apparent to people, anybody that claims this is some weird conspiracy or doing any of that is just going to get an instant block, because I think you're quite delusional if you end up feeling that something that's literally causing lockdowns around the world is a hoax. Yeah, we've had lots of toilet paper being sold out, apparently. Yeah, we're getting all the same things, Laser, with people either dismissing it, saying it's just a flu or not even as bad as the flu or a cold, even though you can see how much damage it's doing to countries where it's really hitting them hard. Panic buying, then the government lying, saying that, oh, we're not going to have shortages of anything because we're in like contact with all the supermarkets and they've said it's fine, even though the supermarkets are saying nobody from the government has actually contacted us. Is what a no, sorry, Joseph. I don't think I've ever watched a Dr. Mike video, in all honesty, and I can't really watch it while I'm doing a stream, but if he's saying that masks aren't helpful, then he's full of shit. That's my opinion on that. Like I said, a lot of doctor channels have been saying the things of, masks are only of limited help, especially if you don't disinfect them properly, which can be true. But again, the problem is lots of people don't even, when they say masks, they don't understand that surgical masks, N95 masks, and then gas masks are totally different, like levels of protection each. All stuff like that. He's not a very smart uni professor, then, is he? Average nerd. Probably the second thing, Joe, but both of those things aren't good, are they? But apparently in Italy now, doctors are having to make the choice as soon as people come into hospital with bad symptoms of anything. Are they going to live or die? Because they've run out of bed space. So if you're in a car accident, even if they could normally save you, they might look at you and go, sorry, your odds aren't that great. You're going to die. No help for you, But sadly, that's what goes on when your hospital systems get overwhelmed. And annoyingly, lots of people don't seem to understand this, that it's not just the illness itself, it's what the effects it knocks on and does to other things. Polish MC1 is fine. It's a very basic mask, but they work. The MS4 filter that comes with the MC1, while it's not the best filter in the world, it should probably protect you from corona. Same with Czech CM3s. Chris, could you talk a bit more about the efficiency of UVB light for decontamination? Wikipedia is a good article for ultraviolet germicidal irradiation, which indicates UVB is limited. Right, how it works is you get UVA, UVB, and UVC, and you get like the wattage range and all those, and like the NM range, whatever they call it, of the lights. UVC is the most effective, but the problem is UVC is also damaging to your skin or your eyes. So with UVC, when they use UVC for decontamination, it's generally done in places people aren't around. Basically, so you often have like UVC boxes where stuff is put in a box of a UVC light, and then, so you're not directly looking and it's not shining on your skin. UVC is by far the most efficient. It also creates ozone, but the problem is UVC is, like we said, not very good to be around. UVB is certainly better than nothing, but again, like UVB you can have on and about near you and it's not going to hurt you, at least not in standard wattage and things, but If a CFF3 filter is equivalent to P3, it will work, yes. I know different countries have different names for them, so just look how does it equate to other filters. If it's N99, sort of N100, P99, P100, P3, P2.5, that's fine. If it's P100, then Justin, yes, it's good enough, because P100 is the same thing as P3. The thing is, right, doctors normally only wear surgical masks to protect you from them, like coughing on you or whatever. When stuff gets bad, you see doctors with N95 style masks on. If stuff gets really bad, you'll see doctors with the full-on hazmat kind of gear on. There was a picture from an Italian hospital yesterday with doctors in literally hazmat gear treating patients in kind of isolation wards. So, you know, tell that to those Italian doctors that, oh, they wouldn't wear gear like that. Well, they're having to wear gear like that or else they get infected as well. It depends which Climax mask you mean, Joe, but in general, Climax masks are fine. They're made in Spain. Yeah, UV light is often used in aircon systems because it kills spores and things in the air vents. Thank you, Lift. Yeah, I hope you're doing all right in Australia. How's it going in Australia at the moment? I've not. Oh, let me look on the chart. Australia, where are you on there? 103 cases now, plus 10 today. Yeah, so that's not good, is it? I mean, it's slower in Australia, but is that due to lack of test kits? Is it due to where it is? We were just literally on about this, Chad Chaddington. UVC is a lot more effective than UVB, but it also burns your skin and eyes. If you want a UV light on most of the time, you'll need UVB. If you're using it in just like a room you're not going to be in, then UVC is better. Yeah, it's because we don't update Peach until about 2 p.m. or just after 2 p.m. UK does daily updates. Now and again, I think Northern Ireland, Scotland, and Wales do staggered updates. So now and again, you might get, you know, extra cases come in from that. And I think sometimes when we get deaths, that's done at different times of day. But in general, the UK is like a lot of the countries doing daily updates at a certain time. Oh, so you're having the exact same problem we're having then, Black Nano Wolf here, where the politicians are not taking it seriously enough because they don't want to damage the economy, which is going to cause a lot more problems further down the road. What sort of spray are you using, Rajiv? But rubbing alcohol is completely fine on the JSP. Let me show you. Where is my JSP? There it is. As long as you don't get... Where's my rubbing alcohol? There it is. As long as you don't get the rubbing alcohol into that bit of the filter, where the particle filter is, spraying it like that, absolutely fine. Spraying rubbing alcohol like that, absolutely fine, because it's a mask made of, you know, rubbers that are designed to be withstanding to chemicals. They say don't use solvents on them. So rubbing alcohol is fine, but don't use solvents because solvents obviously break down rubbers and plastics. I've accidentally broken things before with solvents, not masks, but where I've been using paint stripper and, you know, put screwdrivers in the paint stripper when trying to get paint off of stuff, and then, you know, like the plastic handles of the screwdrivers melt. Cheers, Laser. Yeah, hope everybody is safe. I think the best thing at the moment is vigilance. Get your news from as many sources as possible, because obviously a lot of news sites have been trying to downplay this. If you want a good YouTube channel who's not scaremongering at all, but knows what he's talking about, watch the Dr. John Campbell videos, because he's like an actual nurse who does training for other nurses to do with lung diseases. And he's really worried about the whole thing, but he's not being alarmist, just because he's saying, you know, this is stuff he studies, and, you know, it's worrying looking at the figures. He said, in all his medical career since the 1970s or whatever, it's the worst thing he's ever seen. He said, you know, even worse than when HIV/AIDS originally became a thing in the 70s or the 80s, you know, when people had no idea about how to treat that at all. And he said he thinks it's going to be Spanish flu levels are bad. But again, you know, I don't think he's being alarmist. I think he's just literally looking at the facts and going, this is worrying, because China's only just getting on top of it now, and we know a lot of their numbers aren't correct. But China's only just getting on top of it because of how strict their quarantining has been and all that sort of stuff. And you've noticed the countries it's not hitting as hard are the countries that have been very proactive with quarantining and social distancing and things like that. Don't shake hands, stand this far away from people, you know, in the street, wear masks, funnily enough, cancel big social gatherings. The countries doing that are the ones that are having far slower spread of it, and the hospitals aren't being overwhelmed. The reason South Korea is doing so well at the moment is because they are testing very early on. So when people have it, they're isolated as quickly as possible, and doctors can monitor them, treat them as and when symptoms come on. Whereas countries, even Italy did more measures than the UK, and Italy's getting hit really hard because, Italy didn't test enough to begin with, didn't isolate people fast enough. Stock market's completely collapsed. Let's see what the market's like today. I've not looked at the market data for today yet. FTSE's rebounded a bit today, so most of the markets are rebounding today, but they went down so much yesterday that, they're still not up, they're still down. It's just they went down so much yesterday that when they've gone up today, it's reduced some of the damage from yesterday, but on average the trend is down. If you look at the what's the name of it, Dow Jones, if we get the Google thing up, type in Dow Jones into Google, it will come up with the thing, and then set it to 6 months, or like year to date, or 1 year, or like 5 years. Yeah, go to 1 year on the Dow Jones chart and see how big the drop has been over the last week and a bit due to Corona. Peak Prosperity's videos are good. I prefer Dr. John Campbell's videos because they're much more just kind of let's look at data sort of thing. But Peak Prosperity's videos are good, and he was right about the R0 being high very early on, because he was just looking at the data and saying, look how fast it's spreading. This is going to be very contagious. I know of the Avon FM53. I don't have one, but it's a cool mask. All right, Scounter, Guten Tag, or is that the wrong time of day? Guten Morgen, Guten Tag, Guten Arbeit, whichever one it is. If for anybody wanting to buy stocks, I guess at the moment when they're low, I guess you'd want to invest in companies like Avon Rubber, or companies that make, cleaning products, because they're going to be in high demand at the moment. Certainly don't buy shares in flight companies and travel companies. Stay safe, one man army. It's bad, but I don't think it's going to be too bad for a lot of people. I've bought lots of brand new masks, Jude. I've bought surplus masks and brand new masks because I review both. But the problem is with brand new masks is, unless you're buying from companies like 3M, you can't buy lots of military masks brand new because they're just not sold to civilians brand new. Oh, Captain Lone Star, he said, really enjoyed your streams the past few months. Think our travel bans have helped slow in Australia. Let me add you on Discord now. I'll just load it up. But yeah, travel bans are important. The thing is, a lot of people are going, oh, why does it help? Because even if you're not getting all the cases, you're at least slowing it down. And this is the thing where the UK is really messing up at the moment, is that they're not trying to even slow it down. If you've got cases, at least if you slow it down, hospitals don't get overwhelmed again. Italy are now having to make life and death choices when patients come into the hospital because they're overwhelmed. They say, we'll have to take a quick estimate on what your survival chances are, or how much of a drain you're going to be on the system. Sorry, you're, too much of a risk factor patient. We'll just put you in a ward to die. That sounds really harsh, but that's the reality of what happens when hospitals get overwhelmed. Everybody saw this coming who looked into it, but, they were deploying tanks, weren't they, in Italy in one place because prisoners were rioting and escaping from a prison where there'd been infections and deaths in a prison. So they were deploying the army into that area. Let me look that one up for you, Joe. Disposable coveralls are generally very good. Yeah, I'd recommend going for that. Again, it depends how well they seal, but disposable coveralls are very good if you just want to go in and take them off as you get back in. I don't know exactly where that is, Kelly, but I would certainly recommend getting a lot of protective gear, and then if you don't need it, you don't need it, and you've always got it for later on. Like with these dust masks, right? Let's say you get a mask like this. Let's say you have no need for it with the corona type situation. You can always use these later on if you're sanding, working with dusty materials, working with insulation, as a pollen type mask if you're mowing the grass. There is so many upsides to having a particle mask just laying around, that people seem to forget about. But, Thank you, Christopher. He said, What about Spain? You worried about Spain? I've not been seeing what's going on too much with Spain, other than the cases keep going up. But what, 281 cases today and 5 deaths? Yeah, it is quite worrying. Spain's at what, 1,512 cases now. So yeah, I think Spain does look quite worrying looking at that. I think Spain is probably where Italy was a week ago. Does anybody know any sites where you can look at each country by day and get a chart, so you can, like, say, I want to compare the UK to Italy to Spain and see what the trends look like? Because I bet you the trends look pretty similar on a lot of those. The pollution isn't awful where I am, as much as Oxfordshire does have bad pollution, but you can use those masks for air pollution as well. You definitely want to open a window tighten if you're on a bus, just so there's a bit more clean air flowing around. Where do you think Australia? Again, I want to see if I can find anywhere where you can get the charts of what's been going on day by day. Sorry, you can get the cases charts from Worldometers. Right, let me go back on there then. Annoyingly, Australia isn't on there yet because they don't have enough cases. But what I want to do is just compare, for example, Spain to Italy. So Italy went from having very low amounts of cases, 21, 79, 157, 229, 323, 470, 655, 889, 1000, 128, 1701, 2000, 2500. Let's look at Spain. Although saying that, Spain went from 674 to 1231 recently. So yeah, I think Spain is going to literally be looking like Italy within a couple of days. I think most governments are being idiots. Again, credits to Taiwan and Hong Kong and Singapore. They're getting on top of this because they're taking very proactive measures, not reactive measures. Should you wear eye protection? Yeah, that's advisable because they know it gets in through the eyes, especially if you're on public transport. Yeah, it's because of the very high R naught, Gillian. The toilet paper dealer. Is it literally getting to the stage where toilet paper is like drugs now? Got some good shit here. I'd say assuming it's not a mask that uses 2 filters, but let's just say sets of filters. I'd say 2 to 3 sets of filters per person. More is obviously better in case any get damaged or you need to throw them away. But I'd say, multiple filters per person. So for 5 people, 15 filters, I'd say. Well, I don't know, Jay, if I've got it or just got the flu, but it feels just like a regular flu at the moment, achy and tired. Oh, for people who haven't got goggles and they don't know if they can get goggles, Weapon Collector came up with a really good basic idea, which is get a big plastic bottle. Good luck with that, Tim. Get a big plastic, like 2-liter bottle, get some scissors and cut them out roughly into goggle shape, and then get a band to keep them on your face, and that will actually work. Might sound silly, but that at least gives you some levels of protection. Look at what people are doing in countries where they can't actually get easy access to proper PPE gear, and some people are coming up with some really clever stuff. Yeah, I think that one, Joe, we've actually got in the description, the infographics one, or a very similar thing. Yeah, if you look at all my videos, I got things like explaining about ABEC filters, which explains all this sort of stuff. So ABEC, this is a combination ABEC filter. It says there, see A2, B2, E2, K1, HGP3. Basically, the letters mean what they protect against. The higher the number, the better the level of protection. If the camera wants to focus, come on. Is it going to focus? That doesn't really want to focus, but A is organic vapor, B is inorganic vapor, E is acidic vapor, K is ammonia. So it means, with these, most levels are 2, Ammonia is only level 1 protection, and then particle is level 3 protection. Higher the number, the better. Also, look, that shitty bloody GOST filter is still stuck. Adapter is still stuck on this filter, and it's been cutting up my fingers trying to actually get that open, get that off again. See a little cut on that finger. So yeah, these are shit for the people who didn't see the video yesterday. I would not recommend these. But the people say, why don't you just add O-rings? Because you can just add O-rings to the thing without a GOST to NATO adapter. If you want genuine 3M masks and filters, I'd recommend buying from the proper 3M bit on Amazon. Otherwise, or Screwfix or a place like that. Be very careful on eBay. A lot of them are the Chinese knockoff 3M masks. Chinese knockoff 3M masks are generally not too bad, but the Chinese knockoff 3M filters are pretty much unusable. Oh, hardware stores and small towns goes Jesus. Yeah, I've had a few people say that if you want to get masks, a lot of small town hardware stores still have them in. Yeah, if you've got vents in the goggles, I'd recommend just putting duct tape over them or something like that. They might steam up a bit faster, but it means droplets can't get in. Calvit says, what is that green big filter behind you called? I've got a NATO filter, remember. Right. If you're looking at this filter, this is the one that came with my Romanian M85. I think it's basically a Romanian-made version of the German HAMAC filter or HAVAC filter, whatever it's called, HVAC filter. Are the ones that are normally on German M65 masks. But what I like about this look is, although it's in Romanian, again, if the webcam wants to focus, let's just shine a light over here and see if that helps it focus. It's going to be a bit blinding, but there we go. So yeah, what I like about this is it tells you how long the filter lasts against certain gases and certain concentrations. Let me see if I can help you with that lift. Again, I can't reliably do this because I'm not in Australia, but if I go on eBay Australia, and I'm not doing it with a VPN, so this might give me some problems. Let me just type in filter. Any results? Some of these are really overpriced. Yeah, let me just search RD40 filter. Is there any particular mask you're looking for it for? There's... is there a way I can sort it to Australia only? That's what I want to do. Right, this one apparently ships to Australia. There you go. That's probably not ideal because it'll probably take ages to arrive, but there you go, there's at least that. Pete, Jamie, thank you very much. I hope you feel better. So you can check my message, please. Is the message on Discord or on here? Assume it's Discord, is it? Let me have a look. Was it you saying the alarm just went off in public today? So yeah, have you tried Gamma Scout or RAD Inspector? Wondering if it's good. Measures alpha particles too. Doesn't pop up anymore. Problem solved. Was that you saying that, or was that somebody else? Sorry. Or did you make another comment? Thank you, Max. He said, you doing better today? Yeah, I feel a little bit better today. The main thing is I don't feel almost feverish, even though I wasn't feverish, of a temperature yesterday. Today I don't feel like, hot and kind of nauseous. I still feel very achy and tired, but that's much easier to deal with, really. You just sit about and don't do much. Laser says, I hope if people understand that if COVID-19 is treated unseriously by people who see it as just the flu, it will become far worse, or threats must be taken seriously to prevent it becoming worse. Exactly. That's the thing, is if people get on top of it and governments get on top of it and healthcare systems are on top of it, it isn't all that serious. Well, it's bad, but, it's something that can be dealt with. The issue is where people aren't taking it seriously, it spirals out of control, and that has knock-on effects on everything. Yeah, it could very well be influenza A. I hope it is influenza. I'd much rather have the flu at the moment than coronavirus. But yeah, flu is not nice, even if people have had flu. Again, when people are doing this just the flu thing, it's a lot worse than the flu in terms of infection rates and how bad it is. But you know, the flu itself is serious. Let's not even underestimate the flu, you know, but do a YouTube channel for long enough, I guess, Sam, Kurt, and then I did have swine flu when, well, I think I had swine flu because when swine flu was going around back in 2009, was it? I had all the symptoms and that and was really ill. But when we phoned the doctors, they just said, don't come in. You've probably got swine flu. Just stay off work, school, you know, for like over a week. There's another question that's just coming in on Discord, so I'll read that out loud and answer it. It says, hi Liam, if I need to wash my FM12, will the fabric straps get weak in the water, or can I follow your 10 washing video? Also, does the trumpet part come off? And yeah, FM12, the answer to that is basically yes, and it won't be damaged. That's the answer to that. Thank you, Pete. Resent the message on Discord. Was it in the group chat one you sent, or let me check the group chat one. I can't see any ones on that other than the one I just answered. Was it the FM12 question? I'd say wear a mask and all that in public and keep good distances from people, Hunter, but Singapore is doing a much better job of dealing with this than a lot of European countries and the American countries, you know, like Canada and the US. So in some ways, I think you'd be safer in Singapore at this point than you would in the UK. One of Mike's relatives, you know, weapon collector, he's gone, he's actually in China, and he been to the UK recently and then was back to China because I think he's an English teacher or something in China, or some sort of teacher in China. And he said he actually feels safer apparently in China because they're taking it far more seriously than the UK is, you know. Where China's putting all these quarantine rules in, you feel a lot safer if you're around there thinking you're not going to get it or spread it than if you're just in the UK where the government's going, oh, it'll be fine, don't worry. Yeah, Orient Mako. Now, that's a typical commie thing, isn't it? Blame everybody else. But have I answered your question, Pete? But you can always copy and paste it in here if I've not answered it. Oh, what, the one about the FM12? But yeah, you can wash FM12 straps fine. If you're really worried, take the straps off. But in all honesty, even something like the FM12 straps, if you took them off the mask, you could put them in a washing machine, they'd be fine. I'll stay on this stream until at least 2 p.m. because I want to keep refreshing the thing after 2 p.m. to see if the UK figures come out. If they're late, posting them today. I won't stay on an extra, you know, like hour and a half just to wait for the UK figures to come out, but we'll have a read and what we think of them. I literally heard some people yesterday saying, oh, the UK must be on top of it because the figures yesterday weren't quite as high as the day before. Or it could just be we've not tested enough people. Do I work for the CDC? Well, I'm not American, so I don't work for the Center of Disease Control. But no, Sinai, I don't work for anything like this. I just have an interest in this sort of stuff. I've watched a few of the Medcram videos. Bro, I've not watched all of his, but I've watched a few of his. Problem is, cheap NATO masks is hard to say because, again, I don't think you're going to find much cheap. If you can get Polish MP5s in good condition, and the actual Polish MP5s, not the French Afra masks or whatever they're called, they're good. Finnish M61s, if you put a 60 to 40mm adapter in them, are very good. Finnish M65s and M71s are very good. I thought my M65... There it is. Finnish M65s or M71s are very good. This is the M65, but the M71 is basically this mask with slightly different plastic parts on it. They're very good, but the issue is lots of masks now are just totally sold out everywhere. When they had them in, Commando Store in the US was doing these Scott M110s, which most people think is the M95, but apparently this particular model is the Scott M110. They were doing these for like $30 to $50, so that was a good price for these. Oh, one of my subs just left an insulting message that doesn't even apply to me, but yeah, you can fuck off then if that's your attitude. They were saying you're being... They said, I'll tell you what they said anyway. They said, you're still going out and working. Well, I'm not, despite being sick yourself. I've not been at work since the weekend, and I wasn't ill at the weekend. I came down ill Sunday night, and I've not been out and working today. So, you know, if you mean doing YouTube videos, I'm working. Well, I can do those even if I'm ill, can't I? Yeah, I was saying about that earlier, Matthew. In Hong Kong, one of the reasons I think the numbers are doing, much better than a lot of other countries is simply because people are wearing masks and, following good protocols. Yeah, this is a NATO one, not a Ghost one. It's from the Romanian M85s, which are the Romanian sort of variants of the German M65s. So this is quite a good 40mm NATO filter. Wow, the Watcher, I think that's might what have been a bit implied, but I'm not stupid enough to believe that if I cough on a live stream, it will go through the data and infect everybody watching. Right, Nathan? Hope you're doing all right in Hong Kong. Post your Discord ID lift and I can invite you because you've donated. It's not looking good in California, is it? But good morning to you in California. Thank you, Rusty. Right. If YouTube is censoring your Discord, I don't know how to proceed. Yeah, 2020 started off really well, hasn't it, Laser? I'm trying to think of a good way to see if you can post it. What if you try and post it in a regular comment? Would that work? Because then I can check the comments as soon as I finish streaming, and I can check the held for review and spam ones and see if it comes up there. Because I know in general, the streams, more words are like shadow banned by YouTube on streams and regular comments. Actually, I've got an idea, Rusty. This is very simple. Let me make you a moderator. There you go. Post your Discord ID now, and we'll see if it goes through. Well, some people, the Watcher, are claiming it's a 5G signal that infects people, which is obviously complete bullshit. The thing is, if people are saying certain radio waves make you more prone to infection, I could believe that. That's not too far beyond the realms of science. But where some people are literally claiming it's a 5G infection, and once you've been near a 5G mast, you get the infection and can spread it randomly. There we go, Rusty, it's worked now. Let me add you. Yeah, I think the toilet paper running out is probably the most evil thing in the world, because if you get diarrhea, what are you going to do? If you want to support Ginger, there's a couple of ways you can do it. You can either donate via Super Chats, that's the little button on the side there, or you can donate via Patreon. And then if you've got a Discord ID, you can join the server where we just talk about shit, basically. Yeah, I think most Western nations have a completely irresponsible attitude, no name. I don't think it's just Canada. The UK keeps saying, well, we'll wait for it to get a bit worse before we do anything, then it gets worse. Well, we'll wait a bit longer. Yeah, sponge on a stick, that would work. Or a bidet, or whatever the French have. Those little, like, bum sprayers. Yeah, Matthew, that was good. Getting them to prevent tear gas getting down you means that you've got them for other uses. That was the thing I kept saying. Lots of these masks have multiple uses. It's not a one-trick pony thing. Better than yesterday, James. Somebody was saying if you get newspapers wet, then let them dry. They do actually become quite soft. But don't use a newspaper straight away where it's all crispy and sharp. Right, let me add you lift because you donated. Just a second. I'm getting quite a sore throat though talking, but I think that's just because I'm talking a lot. Not necessarily the flu, or maybe it's the flu. I don't know. Oh, the slightly kind of orangey yellow, really, crunchy toilet paper. Yeah, that stuff's horrible. At least 3, I'd say, Safi. Again, it depends on what use you want for them. If they're the P3, P100, like RD40s, at least 3. If they're kind of chemical protective ones, you want to keep a couple and then sort of do date rotation on them. What do you mean, the 3 seashells? I've got weights at home, Matthew. I don't go out to a gym anyway, but at the moment I would avoid the gym. If you did go, I'd say that's not a good place to go where there's people sweating and exercising in close proximity. 6th UK death reported, oh dear. Let's refresh the thing and see if the UK figures are out on here yet. No, they haven't updated it on the World Meters one. Let me go to the BBC homepage. UK virus tactics defended as case expected to rise. The decision to delay closing schools and introduce other strict measures to combat coronavirus has been defended by England's Deputy Chief Medical Officer. So yeah, we've had another person die. The numbers are going to shoot up again and again. They're saying, no, it's fine. We don't need to do anything. I reckon it'll be over 400 plus. So at the moment, the UK numbers are 321. I reckon, yeah, because we've had like a rise of 60 something in one day before, I don't think 400 is a bad estimate. Also, the UK doesn't seem to be doing that thing where they said they were going to update weekly rather than daily. I think because they got so much criticism for that, they've gone back to doing daily updates. Like, let me have a quick look on Discord then, Lift. If you get, for the question, if you get if you have a Type 80 filter, Israeli Type 80 filter, out of the box it won't fit a Polish MC1. But if you get a rubber O-ring, stick that in and then force the Type 80 on, and then if you want to duct tape over it, it will fit fine. I know you're bodging it that way, but it will make it airtight doing that. If that's answered your question. MXT says, Senpai noticed me. There you go. Right, so let me just check how many cases we're on at the moment. So we're 321 cases at the moment. They'll be doing the daily update very soon for the UK. So what are we all estimating? It's going to be around 400 UK cases then. So by Friday getting to 1,000, it may not, but what you see is as long as there's enough test kits, you notice the number starts going up exponentially. So each day tends to always be a bigger jump up than the last day. But again, it's really hard to say at the moment because, again, it relies on the test kits. And as we've been saying, the issue is even if you think you've got it, a lot of people phone 111 and won't even get tested. They say you've not been at a high enough risk group or something like that, so you're not getting tested. Thank you for the donation. He said, thanks for the heads up about the 40mm Gostinator adapter. Are there any 40mm Gostinator adapters you actually recommend? That's the first one I've bought and it's been useless. And the one I bought is one of the better ones apparently. So no, I wouldn't recommend bothering with them. I'd say just put some extra rubber O-rings in if you're going to try and force a NATO filter onto a Gost mask. Yeah, they have something like a 70 to 80% failure rate, don't they, CT Ranger? Well, the thing is, I don't actually know if this strictly is a Gost mask. A lot of people reckon these are RD40. I found with my particular one, NATO filters never seem to fit that well. Gost filters definitely do. But maybe it's just these have good O-rings in them. I don't know. Yeah, exactly. It's not great for the Fred laser, but it works. But if you have a cheap Gost mask, I'd say, in all reality, adding lots of O-rings and then shoving a filter on is a lot more economical than buying a shitty $20 Gost to NATO adapter that doesn't even work properly, and then shoving O-rings into that, Well, I think this is really bad as it is, Joe, but yeah, in the future, of course, we could randomly see a virus come along or a bacterial strain that comes along that's immune to antibiotics that does a lot of damage. An O-ring, Benji, let me show you one. If I've got a filter cap somewhere, I can demonstrate what an O-ring is. But it's basically, it's like a washer, like a rubber washer. Annoyingly, this MSA filter didn't come with one, but basically, when you open some filters, in filters and the masks, you get you can buy them from plumbing stores and things like that. You get like a rubber ring there. That's what makes the filter make a good seal of the mask. So that's what an O-ring is for the people wondering. You don't wear glasses under a gas mask, Mo, but it won't work with any masks. No, I think CT range, they literally have something like a 20 to 30% accuracy, as in the inaccuracy is 70 to 80%, because with a lot of people, they've had to do 4 or 5 tests on them to get the correct result. Oh, let me add you, because I'm pretty sure you just donated, didn't you? So let me add you. Just a second. What I do is I send out a friend's request, and when you accept that, I invite you to the server. Oh, Ghost Jesus said the free seashells is a Demo Man reference. I've not seen that in years, so that'll be well. I've forgotten it. Apparently, quite a few companies are trying to develop better tests. It's also because you need to do the test in a lab, which is another big issue. Because obviously, if you've got a because they were saying what would be ideal is if they could just literally send a kit to your house that you could swab and it would come back a color if you're positive or negative. Thank you, Nathan. He said, I buy 3M masks, but are China fake and filter 7093. I won't know personally if it's a Chinese fake or not. But the thing is, the Chinese fake 3M masks are generally good enough in terms of the masks. It's just you want to get the real filters. Let me look up the 709 free filter. Which one's that? That's similar to these type of filters, and a plastic case one. They're good filters, those. I'd try not to get the Chinese fake filters, but even if you get a Chinese fake mask and then get the real 3M filters, that would be good. Yeah, you've donated before, Jams, haven't you? So let me add you. Right, I'm going to check the thing and see if the UK figures are out in a minute, because the UK filters are meant to be released quite soon. Right. Let's refresh the thing and see if the UK's posted its cases yet. All right, the UK figures still haven't come in yet. I'll keep an eye on it. Yeah, John, 111 isn't great. Basically, all respect to the people there who are trying to help, but basically 111 is a number where you phone if it's not a life-threatening emergency, where you'd normally phone 999 for people that don't know. And then they're meant to give you medical advice, like whether you need to see a doctor or not and stuff like that. The idea is it takes strain off of the actual health system. The problem's been with a lot of the corona stuff. Initially, they were telling people to go into hospitals or GP surgeries even when people were infected, which was obviously a bad idea, because that meant the infection got spread around. And even after that, when they fixed the system, lots of them were still saying, I don't think you need to be tested, even when people did need to be tested, and all a lot of crap like that. So yeah, as I just explained then, 111 is a UK non-emergency phone number that's meant to give out medical advice, but they've given out a lot of bad advice recently. Again, I can't fault them for everything. Oh, thank you, Rusty. He said, Honeywell, North, Sperry, and Mars in US are really confusing, all made by Honeywell, but 4 different connector types. I've discovered no clear labeling when buying canisters or masks. That's strange. So is it like they do the same face piece, but then they do different connectors for different brands of filters or something? That's very strange. I mean, luckily the one I've got is just the standard RD40 40mm NATO one. I think people are going to need to be pretty prepared for that soon, dear love survival, because it seems at the moment, if the virus isn't going to get you, desperate people are later on. Because they've literally had that when I've been listening to LBC, people phoning in saying people need to get over it. They don't need to stock up on anything. It's just the flu. It's not even as bad as the flu. But if I get told to do what by the government, I'm going to ignore them. A bit better today, Goffson. Yeah, exactly, Ghost Users. If they could just literally send a doctor in kind of protective gear to check on you. I can have I think of that for that. Where is it leaking from? Do you know? Is it leaking from the filter thread where the voice diaphragm is, or just add you on Discord? But any idea which bit it's leaking from? You better get ready, Zach, with the man traps and the guns. I don't know what country you're in and if that stuff's legal, so I better say that's a joke, because the UK doesn't let you make edgy jokes unless you specifically say it's a joke, it's a joke, it's a joke. Freds is one of the best films depicting an apocalypse type event. Pretty grim film. Better today, see Oliver, than I was yesterday. I still very much feel like I've got a flu type thing. Achy and tired, but at least I don't feel, quite feverish today. But I'm not going to be at work for quite a bit anyway, because I've got this weekend off work anyway, so. What's Coach Ella? I have no idea what that is. Let me know what that is in the chat. I'm just refreshing the BBC thing again. I'll get Sky News up as well to see if there's any updates on there. Well, the current thing is UK will see many thousands of people contract coronavirus. That's reassuring, isn't it? But the current update is just that the 6th person has died. Another thing is, stop saying it's a bad flu. Doctor fighting coronavirus shares dramatic account. So the doctors fighting it are getting pretty annoyed with people saying it's just the flu. Oh, thank you, Rec Curve. He said, what's better for urban prepping, Hong Kong and Sydney? Either 4A1 or M15. M15, I would say, because... Where is my M15? I thought it was behind me somewhere. But regardless, M15, because it's got a voice diaphragm, so people can hear you. Well, the A4A1 has a voice diaphragm, but it's not as big. The M15 has a good clear voice diaphragm, so if you shout, people can hear you better. And the M15 is a bit stronger, like the lenses in it are stronger, so if there's bricks and stuff flying around, the lenses are going to be a lot more resistant. I'd say for any use, the M15 is better than the 4A1, but if you can only get a 4A1 or the 4A1 is far cheaper, go with the 4A1. Thank you, Kevin. He says, have you done the vid on entire household filter systems? Also, for anyone that cares, 2 to 3 is really tough to find in the USA now. I've never done one because I wouldn't ever be able to get a system in our house like that. I think you'd need a pretty good, solid, well-insulated house for that to work. But I've done things on like room heater style filters before. I know you can also get like the air kind of inflatable air tents that have a filter blower system that work through them. But again, a lot of that is out of my price range and space, really. But I've done videos on DIY masks before, Neb, so check those out. Just search on my channel like DIY mask, homemade mask, that kind of thing. A lot of them I made were pretty crap and didn't work very well, but it gives you an idea of what might work and what might not. The dust mask I made worked all right though. I'm just refreshing the thing to see if there's any new stuff about corona numbers in the UK, but it doesn't seem like there is. UK's still late doing its daily update. I'll stay on another 5 or so minutes and then I'll go off. I might be on tonight at 8 PM if I've still got the energy, if I'm not asleep. So Laser said, any good movie suggestions for people to watch who are staying home due to quarantine or personal reasons? What, just good movies in general, or ones related to apocalyptic stuff? If you want good funny movies that might cheer you up, things like Airplane, The Naked Gun, Top Secret. Yeah, that was in Ghost. That was in Dr. John Campbell's video earlier today, wasn't it? If you want more apocalyptic movies, yeah, Contagion, Outbreak, Fred's. Oh, Patient Zero's been too obviously a troll. That's annoying. I've got rid of him now. Earlier on, he was just on about some tinfoil hat shit, and I thought he might have been genuine, but then he was just making himself too obvious. Crossbows aren't banned in the UK lift. Crossbows are one of the few things here that are legal, as much as they might want to try and ban them in the future. But yeah, if you're in Australia, can you get regular bows in Australia, can't you? Even if you can't get crossbows, so I'd recommend that. Let me do pop-out chat. Chat's broken again for no reason. Yeah, They Live's good. I like all John Carpenter films. So I would say, yeah, The Fog, Halloween, They Live, The Thing. You can't hunt with a bow in the UK, but you can legally own one. The Road's a good film, but with the survival choices they make, they wouldn't be alive that long. If they really did the decisions they made and things. So the exhale valve on the BEM is loud. Don't know if it is sitting properly, but water flowed back through and poured. So it's your exhale valve that's the problem. I've not got my BEM 4GP handy, but does it have standard umbrella valves? I can't remember. If it does, what you just want to do is see if you can get an umbrella valve multi-pack. Let me link you to the type of thing I mean. Right. I might have to just have a look for a pack on Amazon. called umbrella valves, but weirdly I can't find many coming up on Google searches at the moment. But let me have a look on eBay. But they're like a plumbing thing, umbrella valves. It's what most masks use. Right, anyway, I'll link you to the sort of thing you want to get, and then you can look a bit further yourself. But these are umbrella valves, which if the valves are bad in your BEM 4GP, if that's the right size valve, you can literally just get those and replace the ones in there with it. Yeah, hot fuzz as well is a good recommendation. Better today, Sam, than I was yesterday. Yep. NPC Survivors starts off with a Chinese scientist breaking a vial, doesn't it, with a bioweapon inside. Whoops. But yeah, Series 2 and 3 of Survivors are a bit boring, but Series 1 of the old Survivor series is very good. I think it's because there's quite a lot of people who watch my videos in Australia and New Zealand. Andromeda Strain, that's very good, about the alien virus. I haven't seen Andromeda Strain in ages, but I need to rewatch that. I haven't actually seen The Flu, if that's an old series. I have to watch that. Day of the Triffids, either the old film or the old TV series, but I thought it was called Wuhan 400 in the Dean Koontz book, Gringo Troller. Yeah, I didn't like The World's End as much as Hot Fuzz and Shaun of the Dead, but Cemetery Man, Della Morte Della More is a really good film I like. Last Man on Earth, the Vincent Price one, yep. There was a recent quite good recolor remaster done of that, put on YouTube for free because it's public domain. Yeah, I've watched The Stand. Commando of Arnold Schwarzenegger, yes, excellent. Especially if you get the uncut version where he chops a guy's arm off and beats a guy to death with his arm. Well, I Am Legend, that's the weakest film adaptation of the book I Am Legend. As I say, Last Man on Earth is better. The Omega Man with Charlton Heston's very good. Yep, Doctor Strangelove's excellent. Right, I'll go off in a minute. I just want to refresh all the figures and see if anything's come up. Nothing on the BBC. Nothing on Sky News. Let me go back to the Water Meters one. UK. No, the UK's late releasing its figures. I imagine they'll probably release them like a minute after I finish streaming. But no, I can't see the figures anywhere. So yeah, I'll head off. Thanks to everybody that's donated. Be careful with bleach if you're disinfecting a mask with it, because if the bleach is too strong, you can damage bits of the rubber, because bleach is quite alkaline, so it eats into stuff. It's corrosive. Right, I might be on tonight. Yeah, don't forget to like the stream as you go off. I might stream tonight at 8 if I've got the energy. We'll see. But yeah. Anyway, have a good evening, everybody. Oh yeah, all the old Romero movies, The Crazies, Night of the Living Dead, Dawn of the Dead, Day of the Dead. What was from Sky News? Sorry, Beachmaster. Before I go off, that 6 persons died. Yeah, but the UK's not updated its daily figures yet, because we're all waiting for those. But again, I can't stay on like another 10-20 minutes hoping they release the figures when they're meant to. Yeah, see you everybody. I might be on tonight for anybody in the right time zones to see 8 PM UK time GMT. But thanks for coming on, everybody. See ya.